Hello everyone, let's talk about professions of mental health, and we are going to talk about the clinical and non-clinical roles for this. My name is Joey. I'm a technical educator for IT technology, and I do AI, but I'm also mental health advocate and advocate for other things like national industrialization. I am also SDG aware, and mental health is a part of SDG. That's the development goals by the UN, Sustainable Development Goals by the UN. So, for this lecture, I would like to encourage that we stop using healing. And if we're using uh, the term healing, because most of the time, healing is clinical, right? It's a clinical term, and people would start to misunderstand you that if we're talking about mental health, you are probably crazy or you need medical attention. But in the study of mental health, it's not, and there are a lot of people who's working in mental health workspace who are not dealing with healing, or who are not dealing with the medical practice. So we should stop healing when it comes to mental health, because the reality is this world is challenging place to live, and we are being challenged. And in a world full of pressure, grief, and noise, mental health is how we stay grounded, not how we get cured. So if you are being challenged, I encourage you to call the NCMI chat line. If you're having difficulty living your day-to-day life, you need someone to talk. So just dial the numbers, especially if you're thinking of taking your life. So call your friends, the numbers there. And again, I want to tell you before I proceed that we are living in a very challenging world, especially right now where uh, disasters are happening, corruption is widely, and yeah, there's a lot of challenges for us. So it's a challenging world, and you are not sick, and you are not alone. So let's proceed with the lecture anyway. And as we study, you will learn to realize that, oh, yeah, we really have to stop using that term. So the agenda is the introduction, why it's important to know each professional role in mental health study, and then we will talk about the clinical mental health profession and the requirements to that you have to accomplish before you can practice a clinical mental health profession. And then we have the non-clinical profession, and then why these roles are important. And of course, the summary and call to action. So it's very important to study the roles of mental health, because we have to know where they are located, what's their work, and where they are in the map, and so we can align our goals together. And we're not alone working with this. We are part of the bigger SDG, and we and other groups of individuals are working with us. So understanding the mental health landscape is very, very important. So understanding the roles of mental health profession is not just academic, it's a step toward building a society where care is accessible, stigma is dismantled, and mental health is recognized as a shared human reality. A mental health challenge affects individual, family, and community across all sectors, yet many people don't know who to turn to, what kind of help is available, or how different professionals work together to support recovery and resilience. By studying these roles, we are going to demystify the mental health system, clarifying who does what and where and how, and then empower community to seek the right kind of help at the right time. So for the clinical roles, these are the clinical mental health profession. They are licensed, They practice professionally. They are trained, most of them in the work in the medicine. They train to assess, diagnose, and treat mental, emotional, and behavioral disorder through evidence-based therapeutic method. So it's called clinical because they usually have clinic. You go there, you consult, and then you pay. And yeah, it's interesting to study this because we know, oh, these roles are existing, but we don't know that they are part of the medical mental health profession. So basically, obviously, we have the doctor of psychiatry, diagnosis and the prescribe require uh, diagnosis and prescribe medicine, and it requires doctor of medicine or doctor of osteopathic medicine plus psychiatry and residency. So you have you have to go to a pre-med, and then you go to medical school. After you go to medical school, you go to a residency, and you need to have a medical license to practice. That's the requirement for psychiatry profession. And then we have doctor of psychology. They provide therapy and testing. So the difference is the doctor of psychiatry provides the medicine. The doctor of psychology provides the therapy and testing, and requires doctor of philosophy or doctor of psychology plus license to operate. And then we have the licensed professional counselor. They are mostly also psychology major. They offer talk therapy, requires master degree plus state license. And then we have the licensed clinical social worker. They are the equivalent of our barangay health social worker. So they delivers therapy and advocacy, requires master of social work plus clinical license. Marriage and family therapists are part of the mental health profession. They support couples and family, and requires master degree plus licenses. Then psychiatric nurse or nurse practitioner, so they manage medication and symptoms. They require RN or nurse practitioner plus psychiatric training if you are working in the psychiatric ward. Then we have the school-based psychology. There's a student support learning and requires specialist or doctoral degree plus certification, of course, state license to operate. Then you need, and then you have this one is, I didn't know that we have certified addiction counselor. So these are for managing substance abuse. If you're a drug addict, there's also addiction in gambling. There's also sex addiction and stuff and other addiction. So they are the addiction counselor. They are also part of the clinical mental health profession. Then we have the medical doctor in neurology who handles brain-related condition, requires doctor of medicine and neurology residency. So he, this doctor is specializing on you're probably your brain was hit by something, or you got a mild stroke and you're not able to think. So the no they cooperate with a doctor of psychology and psychiatry to uh, to have a better diagnosis on your case. So in the more advanced mental health cases. So the coverage of the mental or the clinical mental health profession is very wide. We have diagnosis, which administers medicine. Those are the psychiatrists. And for the counseling, which is therapy and testing, we have counselors. We have clinical social workers. We have therapists also belong to psychology branch or main study of psychology. Psychiatric nurse, which is belong to the nursing practice, and psychology-based psychology was also requires psychology major. Addiction counselor also requires psychology psychology council or psychology major plus certification and license, and then we have the doctor of neurology, which studies our brain. So that's the mental health professions. When you talk about healing in terms of mental health, these are the people you are dealing with, right? But there are non clinical mental health professions, so they refer to any role that supports mental health through education, advocacy, peer support, outreach, or system level coordination without directly doing diagnosis and treating mental disorder. These professionals do not provide therapy or prescribe medication, but they are important. They play essential roles in promoting mental health literacy, reducing the stigma, and building safe mental health spaces, connecting individual to care, mobilizing community, and shaping the policy, and then designing assessment and analyzing data for psychometricians and suicide uh, surveillances. So these are the list of non-clinical mental health profession. You have mental health educators who teach us mental health. We have peer support specialists. They are very important because they have life experience. They show they've been there and seen the what happens actually. So uh, you might be a medical doctor, yes, true, and you might have seen someone collapse or have a mental breakdown when somebody extracted blood, but you might have not seen an entire military brigade undergoing blood extraction, and several people is collapsing and having a mental health crisis. And yeah, you might have been in the practice, but you have not seen that in actuality. So it could be most military professional know this, that several people are going down because of fear of the blood, and we call them the peer support specialists. So they have seen many people collapse in school because a tree was hit by a lightning, everybody panic, and then everybody collapse. So they are called the peer support specialists. They're also very important right now because we are experiencing crisis in several regions in the Philippines. So our peer support specialist is the actually going there with the first aider, which is we'll discuss that later. So, and then we have the community health workers who promote wellness, connect to services, and then outreach. They require public health and social work training. Advocates and then outreach coordinators and ambassador. They mobilize community and reduces stigma. They need advocacy, social work, and communication. And then for the church, we have spiritual counselor and pastoral care. They offer emotional spiritual support in faith setting. They require study of theology and mental health sensitivity. And these are the mental health first aiders. So they provide initial support, recognize distress, and guide to help. So we would probably seeing more of this right now in the internet. They are the first one to respond, especially right now that we are having a mental health burden that was brought about by the crisis that we're facing in several regions in the Philippines due to earthquake and typhoon, and others are the victims of corruption. And then we have the program coordinators or program coordinators for non-government organizations. So they manage program organization and the track the impact. So they need public health awareness and then non-profit management. And then we have mental health researchers. So they study trends, evaluate intervention, and form policy. They are actually a part of the psychology study, but they are not having clinic, but they don't have clinic, but they study and do the research for us, for mental health workers. And then we have the psychometricians who are designing and interpret psychology tests and support the clinical teams to support the medical teams. And they can also work in larger population like city or things like that to uh, gather data, for example, the suicide information or suicide data, like how many deaths we have, how many survive, and what age, what's the gender, what's the trigger, and yeah, so we have the data to study with. And right now we have 2,000 plus deaths in suicide alone in the Philippines. So that's big thanks to the psychometricians and data professionals who are working hand in hand on this. So those are the non-clinical mental health profession. And when we are dealing with these people, you aren't sick, right? You had been affected by a typhoon, you have been affected by uh, an earthquake, and you need a medical first mental health first aider to help you cope up with those challenges. So you're just being challenged for this. And most of the time, most of those mental health cases that escalates to suicide falls into this category. So that's why we need to, be lenient when we use need to use the term healing, and we're talking about mental health, because in probably in the yoga space you can use healing, or in some other, um, mental health aware people can understand you, but uh, most of our mental health cases aren't clinical at all. So, and these people are handling those cases. And then why it's important that we study this role. So uh, frame mental health work as essential to the Sustainable Development Goals, number 3, which is good health and well-being. And we're working together as a big family on this. We're part of a bigger goal. And then we need to emphasize how professional reduces stigma, promote literacy, and co-create safe spaces. Include real-world impact stories or community case study. And then we also assess, or we also provide skills and competencies across the role. So for clinical, we have the diagnostic tools, therapeutic techniques, and crisis management. For non-clinical, communication, cultural sensitivity, advocacy, and curriculum design. We also have metrics where um, we can do the escalation of mental health case from non-clinical to clinical. So, and how this role overlap. So we know the distinction. So when it is actually a clinical, when it's the clinical role that should be there, you should know the boundaries between the two roles. And then pathways to enter the profession. So if you're a mental health advocate, so there are actually many roles for you. You could be in the educational route. You could be into the licensure and certification like RPM and MHFA, or mental health first aider, and then social work, and then volunteer and life experience pathway, which are the peer support specialist. And then it's important that we study this because we know where they are. We have people doing mental health in the hospital, which are the clinical mostly. We have people working in school and jail, faith-based spaces and online platforms. So we can also map where these people are, and uh, how will adapt across the sectors. And then it's very important how the other specialization like us, from the IT, where we use IT, AI, and we have data, we have the social media in our field of study, which is IT based, and it's very important that we know this. So who are we going to align with, right? So educators, artists, content creators, and community leaders embed mental work, so we can align with them. Celebrate hybrid roles like mental health, playlist creators, role designer, advocacy strategy. So other sector can also align with these people when we know who to talk with, um, because mental health is not for medical profession alone, it's for everybody's concern, right? Especially right now that we have a very high suicide rate in the Philippines. We're ranging to up to 3,000 deaths. And then challenges and opportunities of burnout, stigma, underfundings in the NGO, how do we work that together? Then innovations, we have teletherapy, so you can call our mental health hotline. And then we have community-based care youth. We have social, we have hotlines from different groups as well from the Armed Forces of the Philippines, and we have Hopeline as well. So Hopeline Philippines, Hopeline PH. So those are the groups that you can call, and then uh, we can right now include tactical hooks like healing in age of hashtag, or from crisis to curriculum like what I'm doing right now. And also for the hashtag, I would like to mention 40 seconds of hashtag 40 seconds of hope while doing this. So those are the new opportunities we have in terms of mental health. And then this is very important because uh, we know how to collaborate across roles. So the example of clinical and non-clinical team working together. So we have a disaster, for example, in Davao, and then we deploy a first mental health first aider there because it's going to create a big, very big issue. It's a big disaster. And then, yeah, we could generate the escalation model for this in the future. And then also we mentioned the mental health first aiders and psychometrician who are providing data for us, which are very important roles as the frontline responder and technical allies, and definitions, credential, and what they're doing. So it's important to know. The call to action is we have a very big, large ecosystem of mental health care, and you could choose if you are into mental health advocacy. There's a lot of opportunity for you to choose which pathway or which path you're going to get involved with. So training, volunteering, doing curriculum studies, or building a curriculum for your school, for example. And then the summary call to action. So mental health is multidisciplinary. It's everybody's role, or everybody every role is important, or every role is matters. Okay, let's replace that. So mental health care is multidisciplinary. And every role matters. So it's important that we know the clinical and non-clinical profession and how they collaborate to support mental clarity, resilience, and inclusive care system. And then for number two, we talk about the clinical professional who diagnose, treat, and manage mental disorders. They use therapy, medication, and assessment to provide direct care. Number three is for the non-clinical allies who educate, advocate, and connect communities to care. So they build awareness, reduce stigma, and guide people toward support. And very importantly, we need to align with the other objectives on the Sustainable Development Goals and build a stigma-free mental health safe spaces. And together they promote good health and inclusive mental wellness. And number five is the call to action: find your place in the ecosystem, learn, support, and co-create change. Whether you are a student, an advocate, or a medical professional, your contribution matters. So that's all for now, and I'm Joey. You can actually those are my number. You can contact me if you want a mental health presentation. I'm a mental health advocate, and I work with data. So if you need work with psychometrics and um, surveillance, or they which uses mental health data, you are free to please feel free to contact me also. We are building this free learning, and this is totally free for you to use, but you can also donate for to us on Aware IT and through Gcash. So that's all for now, and thank you for watching, and happy learning.